Immunohematology, blood preparation, storage, and transportation is a section we will be going over today. Here's the content layout page. We'll be going over 7 sections such as collection, whole blood, plasma, platelets, labeling, storage, and transportation. Blood collection. Blood collection sets must be approved by the Food and Drug Administration. Collection sets must be sterile, transparent, and appropriately sealed. Allow gas exchange of oxygen and carbon dioxide, but not enough that there will be evaporation. Key is flexibility and strength, kink and scratch resistance. Base label must be approved by the FDA to ensure that the blood contents is not contaminated. Whole blood collection. It's part of the closed system. Closed system maintains sterility of the blood, no external air is introduced, internal access point or cannula allows the transfer of components from bag to bag. Once the seal is broken though, expiration date and time must be changed. There will be considered an open system. Primary blood bag and 1 or more satellite containers. Primary bag is used for the whole blood collection. Collection completed, blood bag is processed and separated into components. Whole blood. Whole blood decreased transfusion over the last 30 years. Contains all cellular and plasma components of blood. Coagulation factors disappear with time and plasma diminishes at 1 degree Celsius to 6 degrees Celsius storage temperature. Anticoagulant is mixed with the blood. Average unit of whole blood collected is usually 450 to 500 milliliters of blood. Transfusion is reserved for rare patients that come in who need volume replacement or oxygen carrying capacity. Fully tested fresh whole can be used for neonatal exchange transfusion. Plasma, liquid portion of the whole blood, consists of water, electrolytes, clotting factors, and various proteins. Proteins would include albumin and globulins. Storage at room temperature. Factors 5 and 8 would deteriorate if plasma is not stored at 18 degrees Celsius or below. It is prepared from whole blood by centrifugation or sedimentation. Centrifugation. Heavier cellular components will fall to the bottom of the collection container. Platelets may either be collected from whole blood or an apheresis donor. Apheresis means the removal of 1 or more blood components, such as plasma, platelets, etc. The remaining blood is then transfused back into the donor. It is used mostly on patients to prevent or treat bleeding and thrombocytopenic or patients that are alright but are dysfunctional. Thrombocytopenia means deficiency of platelets, bleeding in tissues, bruising, and slowly clotting after injuries. It is a 2-step differential centrifugation process. First spin is referred to as a soft spin. Whole blood is centrifuged at a speed sedimentated the RBC but retains plasma. It is then separated by applying a heat seal to connect tubes. Additional centrifugation to sedimentate the platelets and removal of most of the supernatant into a second satellite bag. 40 to 70 milliliters of plasma remains on platelets due to nutrients and pH balances in order for it to thrive and survive. After collection, it is to be stored to be cooled at 20 degrees Celsius to 24 degrees Celsius. Platelets are required to be separated from the whole blood within an 8-hour time limit from collection. It is finally placed into an hour resting period before being put into storage. Labeling. The FDA has very specific guidelines for the labeling of blood, detailed in the CFR and guidance documents. Labeling requires must be readable to both humans and medical machinery. Information on label includes name of patient, doctor or nurse's name, time of draw, donor category, expiration date, anticoagulant or preservatives used on component, temperature of storage, unique patient, hospital identification number, and ABO group, and RH type if available. There is a sample on the side to see what we need. Storage. American Association of Blood Banks, AABB. Standards required temperature to be monitored continuously and recorded. Monitoring the temp of the blood component is critical to maintain quality. Not adhering to the guidelines hinders the component and the effectiveness. Recording is required everywhere and anywhere. High and low set points for storage equipment should be set at a temperature that will allow a reasonable amount of time for whoever is on duty to respond before the storage temperature and blood are compromised. Once acceptable high and low range is set, it must be thoroughly investigated and documented. All equipment must be cleaned and maintained in order to be quick and efficient. Storage blood should be properly labeled, restricted areas for suspected or biohazardous blood components if needed. Some hospitals may have a walk-in refrigerator to store them. Some, like our facility, only has a set amount of storage space. Transportation. Every hospital must have an effective transportation system. Blood components must be received in designated blood center with a time frame and have adequate temperature control. They should be shipped out within 24 hours. Whole blood is transported in an ice container within 1 degree Celsius to 10 degrees Celsius. Red blood cells should be recommended to be shipped with wet ice. In leak-proof containers, RBC package must be placed on top of wet ice because cold air travels downwards, and keep at a temperature of 1 degree Celsius to 10 degrees Celsius. If colder blood cells will hemolyze, ice should not touch RBCs. Frozen plasma and red cells can be shipped at negative 18 degrees Celsius to negative 68 degrees Celsius. Use dry ice to maintain temperature. It could be placed both on top and bottom, or you can follow provided protocol. Platelets and granulocytes transport at 20 degrees Celsius to 24 degrees Celsius. Shipping containers should be well insulated and be put to the test, such as maintain required temperature, different transit times, transport modes, potential climatic changes, and others include coolant is placed in certain areas in the container, tested for robustness and the resistance to being dropped, and etc. Thanks for watching!